Have you ever cleaned your glasses, blinked a few times, and still felt that something just wasn't right with your vision? Maybe road signs seemed slightly hazy, bright lights looked unusually harsh, or reading small text became more tiring than it used to be. Most people brush these changes aside, blaming age, eye strain, dry eyes, or simply spending too much time looking at screens. But what if your eyes have already started developing cataracts and you don't even know it? The truth is that cataracts rarely begin with dramatic vision loss. Instead, they quietly develop over months or even years, sending subtle warning signs that millions of people completely overlook. By the time many finally realize something is seriously wrong, the cataract has already progressed enough to interfere with driving, reading, working, and even recognizing familiar faces. In today's video, you'll discover the early cataract symptoms that most people miss, why they happen, who is most at risk, and how recognizing these hidden signs early could help protect your vision and improve your quality of life. Be sure to stay until the end because the final warning sign is one that many people mistake for a completely different eye problem, causing them to delay treatment for far too long. Your eye's natural lens is one of the most remarkable structures in the human body. When you're young, this lens is almost perfectly transparent, allowing light to pass through clearly and focus sharp images onto the retina. Every color you admire, every face you recognize, every sunrise you enjoy depends on that lens staying crystal clear. But as we grow older, or because of certain health conditions, medications, injuries, or genetics, the proteins inside this lens begin to change. Instead of remaining neatly arranged, they slowly clump together, making the lens less transparent. This gradual clouding is known as a cataract. What makes cataracts particularly deceptive is how slowly they usually develop. Your brain is incredibly good at adapting to small vision changes. Day after day, it quietly adjusts, making you believe everything is normal even while your eyesight is becoming less clear. That's exactly why early cataracts are so dangerous. They don't usually announce themselves with obvious blindness. Instead, they whisper through tiny changes that are easy to ignore. One of the biggest misconceptions about cataracts is that they only affect people in their 80s or 90s. While aging is certainly the most common risk factor, cataracts can begin much earlier than many people realize. People in their 40s and 50s sometimes develop early cataracts, especially if they have diabetes, spend years in strong sunlight without proper UV protection, smoke regularly, use steroid medications for long periods, have suffered previous eye injuries, or have a family history of cataracts. Some people are even born with cataracts, although those cases are much less common. Interestingly, many people who eventually require cataract surgery say they never suspected cataracts at first because their symptoms seem so ordinary. In the comments of educational cataract videos, viewers often describe thinking they simply needed stronger glasses or believed aging alone explained their vision changes until they were finally diagnosed by an eye specialist. Now let's talk about the very first hidden symptom that most people completely miss: a subtle loss of sharpness. This isn't the kind of blurry vision that suddenly appears overnight. Instead, it's so gradual that you hardly notice it. Imagine looking at a distant street sign that used to appear perfectly crisp. Now it seems just a little softer around the edges. Maybe subtitles on your television don't appear quite as sharp as they once did. You clean your glasses, assuming they're dirty, but nothing changes. You blink repeatedly, thinking your eyes are dry. Sometimes your vision seems better in the morning and slightly worse later in the day. Because these changes come and go, most people don't connect them with cataracts. They simply adapt. They sit closer to the television, increase the brightness on their phone, enlarge text on their computer, or ask someone else to read small print. These tiny adjustments become part of daily life without realizing the real cause may be quietly developing inside the eye. What makes this symptom especially tricky is that early cataracts often affect contrast before they significantly affect clarity. Contrast is your ability to distinguish objects from their background. Imagine wearing a light gray shirt against a cloudy sky. A healthy eye easily separates those shades. But when contrast begins to decline, everything starts looking flatter and less defined. Faces lose detail, printed pages appear washed out, and objects seem less vivid, even though your eyesight might still measure reasonably well during a routine vision test. This is one reason why some people insist something feels wrong with their vision, despite being told they can still read the eye chart fairly well. They aren't imagining it, they're experiencing subtle visual changes nuances that standard vision testing may not fully capture during the earliest stages. Here's something even more surprising. Some people actually notice temporary improvements in certain types of vision during the earliest phases of cataract development. They suddenly find themselves reading small print without their reading glasses and assume their eyesight is getting better. Unfortunately, this temporary change can sometimes be another hidden sign that the eye's natural lens is changing. Because the improvement feels like good news, people delay scheduling an eye examination. Months later, that temporary improvement disappears, replaced by increasing blur and difficulty seeing clearly at different distances. It's one of the many reasons eye care professionals recommend regular comprehensive eye examinations, even if you believe your vision seems acceptable. Before we move on to the next hidden symptom, ask yourself one simple question. Have you quietly changed the way you see the world without realizing it? Have you started increasing screen brightness, avoiding certain lighting conditions, sitting closer to the television, or blaming your glasses every time your vision seems slightly off? These small habits may seem harmless, but sometimes they are your brain's clever way of compensating for changes happening deep inside the eye. In the next part, we'll reveal one of the earliest warning signs that many people experience while driving at night and why it can become dangerous long before vision becomes noticeably blurry.
Imagine you're driving home after sunset. The road is familiar, the weather is clear, and your prescription glasses are up to date. Yet something feels different. The headlights of oncoming cars seem unusually bright. Streetlights appear to have glowing circles around them. Traffic signals seem to scatter light in strange directions, and you find yourself squinting more than ever before. You slow down, grip the steering wheel a little tighter, and tell yourself it's probably because you're getting older. But what if this isn't simply aging? What if your eyes are giving you one of the earliest warnings that a cataract is beginning to form? One of the most overlooked early cataract symptoms is increased sensitivity to light, also known as photophobia. A healthy lens allows light to pass through in an organized way, creating a sharp image on the retina. But as the lens slowly becomes cloudy, light no longer travels smoothly. Instead, it scatters in multiple directions before reaching the retina. This scattered light creates glare, halos, starbursts, and reduced visual clarity, especially in bright environments or at night. At first, the changes may seem minor. You may notice yourself reaching for sunglasses more often, closing one eye in bright sunlight, or avoiding nighttime driving altogether. Because these adjustments happen gradually, many people never realize they are compensating for a developing cataract. Think about the last time you drove during heavy rain at night. The headlights reflected off the wet road, making it harder to judge distances. Early cataracts can create a similar effect, even on perfectly dry roads. Every bright light begins to compete with the details around it. Road markings become more difficult to distinguish. Pedestrians wearing dark clothing become harder to notice. Depth perception may begin to suffer because scattered light reduces contrast, making objects blend into their surroundings. This is one reason why many people say they feel less confident driving at night long before they notice major vision loss during the day. Here's something fascinating about the human brain. Rather than immediately alerting you that your vision is changing, your brain often develops coping strategies. You begin driving more slowly. You choose routes with better lighting. You stop going out after dark unless absolutely necessary. You avoid rainy nights, believing they're simply more stressful. Without realizing it, you've adjusted your lifestyle around a problem you haven't identified. This gradual adaptation is exactly why cataracts can remain unnoticed for years. The next hidden warning sign is even more surprising, because it doesn't affect sharpness. It affects color. Imagine looking at a crisp white sheet of paper. To a healthy eye, it appears bright and clean. But as a cataract slowly develops, that same white sheet may begin to appear slightly yellow, cream-colored, or even light brown. The change is so gradual that you rarely notice it because both eyes and your brain adapt together. It's only after cataract surgery that many patients say they were shocked by how bright and vibrant the world suddenly looked. Some even describe feeling as though someone had removed a yellow filter from everything they saw. This color shift doesn't just affect white objects. Blue skies may appear less vivid. Green trees can lose their richness. Bright flowers may seem dull. Even your favorite clothing can appear faded without you realizing it. Many people assume manufacturers change the color of their television screens or smartphones because everything seems slightly less vibrant than before. They increase screen saturation or brightness, believing the device is the problem, when in reality, the change is happening inside their own eyes. Now ask yourself another question. Have family members ever commented that your television is much brighter than theirs? Do you constantly increase the brightness on your phone, tablet, or laptop while everyone else says it's already too bright? These seemingly harmless habits can sometimes reflect your eye's attempt to compensate for reduced light transmission through a cloudy lens. They don't prove you have cataracts, but they are worth discussing during a comprehensive eye examination, especially if they occur alongside other symptoms. Another early clue many people miss is that reading becomes strangely inconsistent. Some days the words appear perfectly clear. On other days, the exact same book feels harder to read. Small print seems to fade in and out of focus depending on the lighting. You may blame fatigue, dry eyes, or poor sleep. While those factors certainly can affect vision, early cataracts can also create fluctuating clarity because the cloudy lens scatters light differently under changing lighting conditions. Bright sunlight may temporarily improve vision for one person, while making another person's vision significantly worse, depending on the cataract's location inside the lens. What's remarkable is how often these symptoms are dismissed. Many viewers who later underwent cataract surgery have shared that they spent months or even years assuming they only needed stronger glasses, or that their vision changes were just a normal part of getting older. Some even delayed seeing an eye specialist because they believed nothing serious was happening, only to discover that cataracts had progressed much further than expected. But we're only halfway through this journey. In the next part, you'll discover the hidden symptom that often convinces people their eyesight is actually improving, why one eye may seem clearer than the other, and the specific groups of people who have a much higher risk of developing cataracts years earlier than expected. One of these risk factors affects millions of people every day, and most have no idea it's putting their vision at risk. By now, you may be thinking, if cataracts develop so slowly, how can anyone recognize them before they become serious? The answer lies in noticing the changes that don't seem connected at first. In fact, one of the strangest early cataract symptoms actually tricks people into believing their eyesight is getting better, not worse. It sounds impossible, but this temporary improvement has delayed treatment for thousands of people around the world. Imagine waking up one morning and realizing you can suddenly read a restaurant menu or a text message without reaching for your reading glasses. At first, it feels like a miracle. You smile, thinking your eyesight has somehow improved. Friends might even joke that your eyes are becoming younger. Unfortunately, this temporary improvement can sometimes be caused by changes inside the eye's natural lens as an early cataract develops. Eye specialists often refer to this phenomenon as second sight. As the cataract changes the shape and focusing power of the lens, some people become temporarily more nearsighted. That means close-up objects may appear clearer for a while, even though the cataract itself is continuing to grow. It's one of the most misleading signs because it gives a false sense of security. Months later, that temporary clarity disappears, replaced by increasing blur, glare, and difficulty seeing at every distance. Another symptom that often confuses people is double vision in only one eye. Most people associate double vision with brain disorders or nerve problems. While those conditions certainly require urgent medical attention, cataracts can sometimes create a completely different type of double vision called monocular double vision. Here's how it happens. Instead of light passing smoothly through a clear lens, the cloudy areas scatter and split the incoming light. As a result, one eye may produce overlapping or ghost-like images, while the other eye sees normally. You might notice letters appearing doubled, lights creating multiple reflections, or objects looking slightly duplicated. Cover one eye, and the doubling disappears. Cover the other eye, and it returns. Because the symptom can come and go, many people dismiss it as fatigue or dirty glasses. In reality, it may be an important clue that the lens is no longer perfectly transparent. Now let's talk about another hidden warning sign that quietly changes the way you experience everyday life: poor contrast sensitivity. Earlier, we discussed how contrast helps you distinguish objects from their surroundings. As cataracts progress, this problem becomes even more noticeable. Imagine walking down a staircase with gray steps and dim lighting. Suddenly, it's harder to judge where one step ends and the next begins. You hesitate before stepping forward. Or imagine pouring coffee into a dark-colored mug and struggling to judge the liquid level. These tasks rely heavily on contrast rather than simple sharpness. That's why many people with early cataracts say they feel less confident walking in dimly lit restaurants, movie theaters, parking garages, or unfamiliar buildings. Their visual acuity may still seem acceptable, but the quality of vision has already started to decline. Perhaps the most frustrating symptom is constantly changing glasses prescriptions. You visit your eye doctor because your vision seems blurrier than before, A new pair of glasses helps for a few months. Then, the blur slowly returns. Another prescription is written, but once again, the improvement doesn't last very long. This cycle continues until one day the eye doctor explains that glasses are no longer the main issue. The real problem is that the eye's natural lens has become cloudy. If you've needed frequent prescription changes over the past few years, especially combined with glare or fading colors, it may be worth asking your eye care professional whether cataracts could be contributing to those changes. Now let's discuss who faces the greatest risk. While age remains the leading factor, several conditions can accelerate cataract formation years earlier than expected. Diabetes is one of the biggest contributors because high blood sugar can damage proteins inside the lens, speeding up clouding. Long-term use of steroid medications, whether taken as tablets, injections, or certain eye drops, may also increase cataract risk. Smoking exposes the lens to harmful oxidative stress, while years of unprotected ultraviolet UV sunlight can gradually damage the lens over time. A strong family history may also increase your likelihood of developing cataracts at a younger age. Even previous eye injuries or surgeries can trigger cataract formation earlier than normal. Here's something many people don't realize. Cataracts are no longer considered a condition that affects only the elderly. Numerous patients in their 40s and 50s have shared that they were shocked by their diagnosis because they believed they were too young. Some viewers have even described discovering cataracts in their teens or early adulthood due to genetic factors or previous eye conditions. Others reported that diabetes, severe nearsightedness, or steroid treatments accelerated the process far earlier than expected. The encouraging news is this: recognizing these warning signs early gives you options. Cataracts usually develop gradually, and regular comprehensive eye examinations allow your eye care professional to monitor their progression and recommend the right treatment at the right time. You don't have to wait until you can barely see. Modern cataract surgery is one of the most commonly performed procedures worldwide, and many patients describe being amazed at how much brighter, sharper, and more colorful the world looked afterward. In fact, many people who were initially frightened about surgery later shared that the procedure was much easier than they expected and significantly improved their quality of life. But there's still one crucial question left to answer. How do you know when it's time to see an eye doctor, and are there any warning signs that should never be ignored? In the final part, we'll separate normal cataract symptoms from dangerous eye emergencies, reveal what actually happens during a cataract examination, explain what you can do to help protect your vision, and expose the biggest myths that continue to stop people from getting the care they need. If you've made it this far, you've probably realized something important. Cataracts don't usually steal your vision overnight. They quietly change the way you experience the world, one small symptom at a time. A little more glare here, slightly duller colors there, a new glasses prescription that doesn't seem to last. These subtle changes may not seem alarming individually, but together they can tell an important story. The question now becomes, when should you stop waiting and schedule an eye examination? More importantly, how can you tell the difference between a cataract that can be monitored and an eye problem that needs immediate medical attention? Let's start with something reassuring. In most cases, cataracts develop slowly, giving you plenty of time to work with your eye care professional and decide when treatment is appropriate. Surgery is not usually recommended simply because a cataract exists. Instead, the decision depends on how much the cataract interferes with your daily life. Ask yourself these questions. Are you struggling to drive safely at night because of glare? Are you avoiding reading because the words seem faded or blurry? Do you have difficulty recognizing faces across the room? Have you stopped enjoying hobbies like sewing, painting, woodworking, or photography because your vision no longer feels reliable? If your eyesight is preventing you from living the life you want, that's often the point when it's time to discuss treatment options with an ophthalmologist. During a comprehensive cataract evaluation, your eye doctor doesn't simply ask whether your vision is blurry. They perform several tests to understand exactly how your eyes are functioning. Your visual acuity is measured using an eye chart, but that's only the beginning. The doctor will also examine your eye with a slit lamp microscope, allowing them to see the natural lens in remarkable detail. They can identify the type of cataract, estimate how advanced it is, and determine whether another eye condition might also be contributing to your symptoms. Your pupils may be dilated, so the retina and optic nerve can be carefully examined. This step is extremely important because not every vision problem is caused by cataracts. Conditions such as glaucoma, age-related macular degeneration, diabetic eye disease, or retinal disorders can also reduce vision. and some require urgent treatment. This leads us to one of the most important messages in this entire video. Not every blurry eye is a cataract. If you suddenly lose vision, experience flashes of light, notice a curtain-like shadow moving across your vision, develop severe eye pain, or see a sudden explosion of new floaters, those symptoms are not typical of a slowly developing cataract. They may indicate a retinal tear, retinal detachment, acute glaucoma, or another serious eye emergency that requires immediate medical attention. Never assume every change in vision is just cataracts. When symptoms appear suddenly or are accompanied by pain, seek urgent professional care without delay. Now let's answer another question people ask every day. Can cataracts be prevented? While aging cannot be stopped, there are several healthy habits that may help protect your eyes and potentially slow the progression of lens damage. Wear high-quality sunglasses that block 100% of UVA and UVB rays whenever you're outdoors, especially during prolonged sun exposure. If you have diabetes, keeping your blood sugar under good control is one of the best things you can do for your eyes. Avoid smoking, since tobacco increases oxidative stress inside the lens. Eat a balanced diet rich in colorful fruits and vegetables that provide antioxidants such as vitamins C and E, lutein, and zeaxanthin. Stay physically active, manage blood pressure, and schedule regular comprehensive eye examinations even if your vision seems fine. Early detection doesn't always mean immediate surgery, but it does allow you and your doctor to monitor changes before they begin seriously affecting your life. Perhaps the biggest myth surrounding cataracts is the fear of surgery. Many people delay treatment because they imagine a painful, risky procedure with a long recovery. In reality, cataract surgery has become one of the most commonly performed and successful operations in modern medicine. It is typically completed in less than 30 minutes, and most patients return home the very same day. The cloudy natural lens is removed and replaced with a clear artificial lens, called an intraocular lens, or IOL, which stays inside the eye permanently. Recovery is usually gradual over the following days and weeks, and many people notice brighter colors, sharper details, and improved vision surprisingly quickly. In the comments of educational cataract videos, countless patients have described being nervous beforehand, but later saying the procedure was far easier than they expected, and that the improvement in vision felt life-changing. So, what's the biggest lesson from today's video? Cataracts rarely begin with complete blindness. They begin with whispers. A little more glare while driving, colors that slowly lose their brilliance, glasses that never seem quite right, difficulty reading in dim light, halos around headlights, frequent prescription changes. These aren't just inconveniences, they may be your eyes asking for attention. The earlier you recognize these signals, the sooner you can take action, protect your independence, and make informed decisions about your eye health. Before we finish, here's a simple challenge for you. Think back over the past year. Have you noticed any of the symptoms we discussed today? Maybe you've been turning up your screen brightness, avoiding nighttime driving, or wondering why your newest glasses never seem as clear as you expected. If any of those sound familiar, don't ignore them. Schedule a comprehensive eye examination and have your eyes evaluated by a qualified eye care professional. A simple exam today could help preserve the vision you'll depend on for years to come.